So, can you tell us a little bit more about your subjective experience of what's, your inner experience of, or your inner state when you're in a shamanic trance, like what we saw depicted in the movie? There's an attempt to capture it through some of the imagery, but is it something that you can try to describe to us what it feels like?
Oui, bien sûr. Les grandes caractéristiques de ces états de transe, c'est que la force est augmentée, la perception de la douleur est diminuée, on a accès à des informations auxquelles on n'a peu ou pas accès dans un état de conscience ordinaire, et donc c'est ce qu'ils appellent le monde des esprits. On voit des images, on voit des personnages, et surtout on a l'impression de se transformer en quelque chose qu'on n'a pas l'habitude de connaître de soi.
So yes, the main characteristic of a state of trance are increased physical strength, a diminished receptivity to pain, and an access to information that comes under the guise of images or characters, which is understood in this cosmology as being the world of spirits. So all of this with a feeling of transformation of the self, where we feel like it's a self that isn't quite the self anymore.
Alors quand Arthur Rimbaud dit « la poésie n'est pas la parole du jeu, mais de l'autre en moi », la question est, est-ce que c'est cet autre en nous que peut révéler l'état de transe? Est-ce que ça parle de ces moments d'inspiration ou quelque chose d'autre agit en nous? Est-ce que ça parle des eureka que vivent les scientifiques? Est-ce que tout ça est du même ordre? Est-ce que c'est dû à ces états non ordinaires de conscience?
So when Artaud says that poetry is not the word of the I, but of the other within the I, the entire question here is whether it is this other within the I that is at play in these non-ordinary states of consciousness, and whether these are the same that are that appear in different forms of research, whether it is the eureka moment that scientists may have, or any other forms of illumination, trying to understand how all of these altered or non-ordinary states of consciousness combine and meet.
So a question for Corine and Audrey as well. How there are experiences of trance states in many cultures around the world. So is your understanding, well, first of all, how do you think about trance and its effect on the brain from a scientific perspective? And also, is it an experience that you see as being culturally specific or universal? And how do you see the interaction between the universal and the culturally specific in these states?
I will try first in English. I will not, so your question is that if there is any specificity in the cultural level, I mean, I will not focus on the cultural difference. People will observe in the interpretation of these states. I mean, at the scientific level, in the research level, we are not going to interpret the difference, the cultural difference. My main approach is the cognitive science, cognitive neuroscience, and cognitive psychology. And actually, we are not focusing on the yes, as I said, the difference in terms of interpretation, but more the manifestation of this state. So for me, there is actually, it's a common or universal state, but of course there is a cultural difference in the interpretation of this manifestation, but I'm not focusing at this first level. I don't know if I was clear.
Do you want to add anything to that?
Oui, donc ce qu'on sait aujourd'hui, c'est que toutes les cultures dans le monde ont développé un accès à cet état de transe. L'essentiel au départ, c'était d'arriver à communiquer avec ce qu'ils appellent le monde des esprits pour essayer d'obtenir des informations qui étaient plus grandes que ce que leur intelligence pouvait leur donner. Et donc ces informations, c'était le rôle du chaman de les ramener à la communauté pour répondre à des questionnements de la communauté et des besoins de la communauté. Donc par exemple, quand on part à la chasse, on va demander à l'esprit responsable du troupeau de rennes, par exemple, ou de bisons, de bien vouloir accepter de donner un animal aux humains qui vont... Alors, on ne parle pas de chasser là-bas, on parle de prélever.
What we know today is that every culture on Earth has developed some form of relationship to a form of shamanic mediation. It's in all places. There's a relationship to what is understood as the world of spirits, as a place of information that exceeds individual intellectual capacities. And so whatever the needs of the communities are put in the form of a question that the shaman then brings to the spirit in question. An example of this would be if somebody is going hunting, one might have the shaman communicate with the spirit that is in charge of the animal group that is going to be collected. They don't use the term hunting, or collected is one way to say it. So that the spirit will part with an individual animal that the humans are on their way to collect.
Et en échange, l'animal qui est l'esprit du troupeau, l'esprit en chef du troupeau, va donner l'endroit où se trouve le troupeau. Voilà, donc ça démarre d'une négociation que fait le chaman, par exemple.
So in this example, then there is an exchange of information where the spirit in charge of the herd might disclose the location of the herd, and in that way agree to that transaction. So it all begins with a negotiation in which the shaman takes part.
I imagine that there's in the same way that the experience is interpreted according to a particular, cultural tradition and worldview, that there are also different ways of gaining access to that state. So in this case, it's drumming, but in some cultures it might be dancing, as in the Sufi tradition, or using a psychedelic drug, or other kinds of mantras, visual ways of having access, but they're all accessing a similar kind of non-ordinary state of consciousness. Is that what you would view that?
On peut pas dire que c'est similaire parce qu'il y a autant de trans que d'individus et autant de trans vécus par individu. Voilà, donc il n'y a jamais une trans qui est la même. Donc on peut pas dire qu'on accède à la même chose puisque chacun accède à quelque chose qui est différent en fonction de ses besoins. Voilà, donc on ne peut pas dire et définir vraiment ce qu'est l'état de transe puisqu'il est différent pour chacun. On peut le définir par ce qu'on ressent, ce que je disais tout à l'heure, plus de force, on ressent moins la douleur, on a accès à des informations.
Like the sensoriality.
Si, en français, parce que comme
Donc l'hyperémotionnalité, les perceptions somatosensorielles qui sont changées, le temps qui est altéré.
So it can't be stated that all of these states of trances are similar insofar as there's as many forms and as many trances as there are individuals who are potentially in trance, and then per individual there's also a variety of different experiences. So no two trances are ever strictly speaking the same, and so that cannot be stated or defined in that way. But as I was saying earlier, we can identify common characteristics like increased strength, decreased pain, information, and then somatic and emotional heightened experiences and altered sort of forms of emotive states.
Alors, il y a 20 ans, en Occident, on jugeait que la transe était ou une simulation, C'est-à-dire que les chamans voilà, faisaient un rituel et ça faisait partie d'un rituel. C'était une théâtralisation. Ou alors, c'était une psychopathologie. Voilà. Il n'y avait pas d'intermédiaire. Donc, il y a 20 ans, c'était ou l'un ou l'autre.
So 20 years ago, in sort of Western Europe or in the West, the way that it was considered is that forms of trance were either looked at as a simulation, as a kind of theatrical enactment for whatever folkloric purposes, or on the other hand, a kind of psychopathology, and there was no in between.
Et pour toutes les raisons dont on a parlé, plus de force, le ressenti diminué de la douleur, pour toutes ces raisons, j'avais l'impression, que je n'avais pas de pathologie d'ordre psychiatrique, et que je ne simulais pas, puisque vraiment, il se passait quelque chose. Voilà. Donc, pour toutes ces raisons, j'ai voulu comprendre et j'ai voulu aller en Occident, retourner en Occident et parler avec des scientifiques qui pourraient faire des mesures de mon cerveau et définir et démontrer que cet état était peut-être pas si pathologique que ça.
And then being a subject of trance, I could tell because of all of the characteristics that we just cited, that for one, I wasn't experiencing any pathological dysfunction, and that for the second, I wasn't simulating it. And so sort of this made me want to come back to Western scientific practices and speak to researchers who were going to be able to help me investigate by mapping my brain out, as we saw, and trying to understand what actually goes, what happens in the brain during these states.
On le voit dans le film, le premier médecin que j'ai rencontré, qui était mon médecin, voilà, a dit quand même il faut vérifier, et donc il m'a donné la carte du psychiatre. Voilà.
As you saw in the film, the first doctor that I spoke to, who was my doctor, still had this this inclination to give me the psychiatrist card at the end of the meeting and saying that I should get a checkup.
So where did this research lead you? What have you been finding out about what actually happens at a physiological level in the brain in this state?
Alors les premières recherches, elles ont été faites en 2007 à Edmonton, au Canada, avec le professeur Flo Henry, qui est un psychiatre, neuropsychiatre, et responsable d'un laboratoire de recherche EEG. Donc ça a été le premier à pouvoir mettre des électrodes sur ma tête, mais pour pouvoir mettre...
So the research started in 2007 in Edmonton in Canada with Dr. Flo Henry, who is a
neuropsychiatre,
a neuropsychiatrist, who was able to make the map that we see in the film.
Et pour pouvoir mettre des électrodes sur la tête, il a fallu que j'induise la transe par la seule volonté. Je ne pouvais pas avoir un tambour, parce que quand on fait un électroencéphalogramme avec ça sur la tête, on n'a pas le droit de faire des mouvements, il faut rester immobile. Et donc, on ne pouvait pas faire ces enregistrements si j'avais le son du tambour. Donc, le deal était là, c'est tu dois arriver à faire une transe en induisant la transe par la seule volonté. Voilà, ça a été ça le départ de cette...
So the challenge was that to be able to do the electrocephalogram, which is the helmet that we saw, when you're wearing one of these, you're not allowed to move. And so the challenge was that I was going to have to find a way to come into a voluntary state of trance without the aid of a drum, which I couldn't be beating for myself. And so this was the deal. It was finding a voluntary path to it, so to be able to begin the research.
Donc là, j'ai compris qu'il était possible d'induire une transe, puisque j'arrivais à le faire par la seule volonté. Et ces premières recherches, donc l'enregistrement EEG a été possible à partir de là. Et les résultats ont été que, d'abord j'avais un cerveau sain, donc il n'y avait pas de psychopathologie, et que l'état de transe était plutôt un ajustement du fonctionnement cérébral à une situation singulière. Ça n'avait rien de pathologique. Donc ça a été la première étape.
And so in that process, I found that it was possible to induce a state of trance voluntarily, and that allowed for the first recording of my brain to occur, from which we gathered that, for one, my brain was healthy. There was nothing psychopathological found, and that, if anything, the state of trance was a readjustment or an adjustment of cerebral function to a singular context. So again, a healthy reaction to a form of stimulus.
Et à partir de là, si j'avais un cerveau sain et que j'étais capable d'induire la transe par la seule volonté, je me suis dit, il n'y a pas de raison que les états de transe soient réservés qu'à une petite population de chamans, du moins en Mongolie. Et donc, on a probablement tous ce potentiel en nous. Simplement, pour certains, il est davantage en sommeil que pour d'autres. Et pour moi, je n'ai eu de cesse alors d'essayer de trouver une méthode pour permettre à chacun d'accéder à la transe. Voilà ce qu'on enseigne aujourd'hui.
And so, from the fact that I did have a healthy brain and that I was able to find an involuntary method to induce those trances, I gathered that there was no reason that the capacity for trance state be confined to a small portion of the population, as is contextually placed in Mongolia, for example. And from then on, I started wanting to develop a method that would allow anybody to be able to attain those states voluntarily, going from the idea that if this is a potential that we all have, we could perhaps just see it that certain individuals have a more awake capacity and a more asleep capacity, but all of which could be worked with.
So your working hypothesis when you're doing this work is that this is something that anyone can learn, that people have more or less talent for it, but that it's not something that's reserved to people who are selected or who have a particular gift. Is that right?
Exactement. Et donc aujourd'hui, on peut former des gens en 4 ou 5 jours à auto-induire une transe, c'est-à-dire qu'on a mis en place avec des chercheurs des sons qui sont plus efficaces que le tambour. Le tambour va provoquer une transe telle qu'on la voit en Mongolie sur 0,001% des gens. Et grâce justement à du travail avec des scientifiques, on a pu améliorer les effets du tambour. Et aujourd'hui, on a des sons électroniques qui sont plus du tambour, qui provoquent une transe chez 90% des gens.
Exactly. So that's what the method that we've been developing now can help train anybody in 4 or 5 days. We work with electronic sound, or working with researchers and scientists to develop the most efficient sort of sound currents, seeing that the Mongolian drum, for example, only will produce a trance in 0.001% of the population, whereas the sounds that we've come to create will induce a trance in 90% of the population.
Donc maintenant, on a défini que c'était vraiment un potentiel du cerveau humain, et on a baptisé cette transe auto-induite, transe cognitive auto-induite, et on peut former aujourd'hui autant de sujets d'études qu'on le souhaite, ce qui a permis l'ouverture de protocoles de recherche qui vont aujourd'hui s'appliquer en psychiatrie, en oncologie, sur la rééducation, enfin dans plein de domaines qu'on est en train de mettre en place et de développer grâce à l'Institut de recherche Transciences, dont Audrey est la directrice.
So, having then established that the capacity for trance is an almost standard capacity of the human brain, we've refined this method and baptized it as self-induced cognitive trance. Which then allowed us to train as many subjects as were available, and that then allowed for the opening of a center of research that Audrey is the director of.
If I can add something, like you have to realize that this idea that we can learn to auto-induce, self-induced trance is kind of revolutionary, because now more than, I think, 3,000 people are able to like self-induce this specific altered state of consciousness in less than maybe 2 or 3 minutes, without any sound, without any drugs, without anything, just by will. I mean, and as a scientist, for me, it was a blessing, if it's the term, because at the beginning, like the first study were only conducted on Corine's brain, but Corine's brain is not like everybody's brain, and we were not able to infer any conclusion of about what is happening in the brain, but not only in the brain. There is not only the brain. I mean, in the body, like. But now, and plus this person that have been trained to this practice, me included. I mean, we built a community around the Trance Science Research Institute of about almost 300 researchers, therapists, doctors that have been trained and are invested into the research on this topic, actually.
In just another couple of minutes, I'm going to allow members of the audience to ask a question or make a comment if you'd like to. There's a microphone set up down here, so if you can sort of make your way down there, that will be a way of letting me know that you might have a question. Can you tell us a little bit more about the kinds of context in which self-induced trance is being used? I mean, is it in the medical community, the therapeutic community, among artists? What are some of the applications that people are interested in learning this to apply it to?
I mean, at a research level, we are interested in like understanding what is happening globally during this state, and also what are the potential effects practicing trance, self-induced trance, could have on, I don't know, or cognition, or attention, or emotion, like everything of physiology, or strength, or body, etc. So it's not directly an application, but it's a way of studying this mechanism or this state. So you were speaking about my research on social cognition, meaning, like, for example, we are interested in understanding if practicing trance could, for example, influence the way we recognize the emotion of others, the way we are empathic, because it has been already shown for other altered state of consciousness, for example, meditation, even hypnosis, or actually psychedelics. We also are interested in understanding the links, for example, between the trance and the creativity. So this is some few example of the research direction we are using at a fundamental level. Then, in terms of application, for example, we have strong hypothesis about the fact that maybe experiencing this state could have an effect on, for example, emotional regulation and stress management. So we are trying to push this area of this practice, for example, for persons that are really often exposed to stress situation, for example, as firefighters or healthcare professionals. And we are launching 2 studies, 2 research projects with this particular kind of population, to determine if at a long-term level practicing self-induced trance could help them to deal with a stressful situation, could help them to regulate more, deal with their difficult emotion. So we were speaking about the fact that trance, for example, could modify the way people perceive their body, their strengths, their pain. So we have the strong intuition also that it could be useful for athletes or sportive, I don't know how to say that, or even, for example, we were kind of approached by astronauts because they were interested in trying to investigate if this non-ordinary states of consciousness could, for example, help them to deal with the pesanteur effect, gravity effect. And of course, the last but most important domain where we would like to applicate or to see the application of trance is at a therapeutic level for patient, but maybe not every type of patient, but we are moving slowly and cautiously at the therapeutic level domain as other altered state of consciousness were confronted to, for example, meditation, or now there is a strong new interest for applicating, for example, psychedelics into therapy. So we are like going to follow the same path. Now ongoing is a study on oncology in the oncology cancerology domain, cancer domain, to see if when patients are trained to self-induced trance, it enhance, for example, their recovery, or they are less tired, less suffering, more happy, even with the treatments. There is maybe promising results also in the epileptical domain. We observe that certain specific epileptic crises named non-epileptical psychogenic crisis could maybe be related to specific form of trance. And Corine was she was training 2 patients, and they now are non-subject to this kind of crisis. So it means that maybe they are able to control this type of crisis.
It's a complete recovery for them.
One last question, and then I think we have some people who are waiting to ask questions from the audience. There's been a lot of interest in recent years in the United States in the use of psychedelic drugs like LSD and psilocybin and MDMA, both in doing research on their impact on the brain and also on their potential use in therapeutic settings in particular. So Michael Pollan wrote this book called How to Change Your Mind, and there's now a Netflix documentary made about this new research and new efforts to use it in therapeutic settings, which apparently actually was done in the 40s and 50s and 60s, and then outlawed beginning in the 80s in the war on drugs. So how does your research compare to that kind of research and application in a therapeutic setting? Is the effect of trance similar to that of psychedelic drugs? How do you compare these 2 approaches and experiences?
There is too many questions in your question.
Sorry. Yeah, that's a lot.
First, the comparison between, for example, psychedelics induced state and the trance state we are speaking about. I think they have a lot in common, but for example, the effect that people, the state that people are going to experience between MDMA or LSD or even DMT are really different. For example, some of them will experience, I don't know, emotional openness, some other ego dissolution, some other like hallucination, visual hallucination. So even inside the psychedelics domain, the subjective experience is really, really variable between subjects. But they do have a lot of dimension in common. The one that we were speaking about, the fact also that the anxiety level is usually very low during this altered state of consciousness experience. This was for the comparison between psychedelics and trance.
Les psychédéliques sont l'induction de la transe, d'accord? Donc, il faut pas confondre ce qui va induire et permettre à la personne de changer d'état de conscience avec l'état de conscience lui-même, d'accord? Donc, le psychédélique est juste une façon de mettre la personne, donc c'est ce qu'on appelle une induction, d'induire l'état de transe. Donc il y a plein de façons d'induire un état de transe, mais c'est l'état de transe qui lui-même va être le processus guérisseur. D'accord ? Donc en fonction de l'induction, on va avoir des états de transe qui vont un peu varier, mais chaque état de transe va participer à une régulation émotionnelle ou quelle que soit l'induction.
So the psychedelics are a tool for the induction or the inducement of states of trance, and we shouldn't confuse the method of inducement to the trance state itself. In all cases, it is the state of trance that is the healing process, and if you induce it by different means, that is going to have some effect on the sort or type of or quality of the states of trance that is achieved. But in any case, it is the state of trance that will then have effect on emotional regulations and some of the benefits that we were just discussing.
Voilà, donc là, le travail qu'on va mettre en place, c'est d'essayer de voir sur les syndromes de stress post-traumatique, en quoi la pratique de la transe auto-induite, donc là, il n'y a pas de psychotrope, mais de psychédélique, mais juste la volonté. Donc, il n'y a pas les side effects. Et donc, on va voir si on a les mêmes résultats sur toutes ces difficultés psychiques, psychiatriques, qu'avec les psychédéliques.
And so the next thing that we're going to put in place now is trying to see how self-induced trance, which is to say without any psychedelic aid to attain this voluntary state, on subjects of that suffer from a post-traumatic stress disorder, and trying to see whether the effects of the self-induced trance can come and match some of the things that have been observed with the help of psychedelics.
Voilà, mais toujours dans l'idée que l'un ne doit pas remplacer l'autre, c'est pas l'idée, c'est que ce soit complémentaire et que ce soit vraiment adapté aux besoins d'un patient qui pourrait par exemple pas supporter les psychédéliques, les psychédéliques. Donc trouver un moyen de lui permettre d'accéder à ça juste par la volonté, c'est une façon complémentaire aussi d'accompagner de toute façon et de mettre le patient au centre de la thérapie en développant ses propres ressources dans ce domaine.
And so the point is not for one to replace the other. The idea is to find what kind of complementarity these different methods can have so as to allow each patient to be at the center of that healing process, developing their own resources. So in the case, for example, of somebody who wouldn't respond well to psychedelics, for that to be an option also. So it's about developing a panel of complementary methods towards the state.
Would you like to ask a question? Happy to. Just tip the mic down and speak into the mic so that we can hear you. Yeah.
Is this good?
Yes.
Okay. Let me preface my comment or question by saying I'm a believer. I researched a book in Haiti years ago and got very involved in voodoo and saw remarkable things and had my own experiences. Also, I was in a very classical Freudian psychoanalysis at the time. So when I'd come home to Boston and tell my therapist what had happened to me, she was quite fascinated. But I'm curious as to the differentiation of trance from the heightened suggestibility in a classical Freudian analysis, for example, and also self-hypnosis. And I have an architect friend of mine who kept passing by this great job because he was frightened of the public speaking. Then he was able to walk on coals without a blister. And so when he'd come to a microphone like this, he'd get in the same state as he was walking on those coals.
Okay,
Could
so
you-
your question is about
That's it.
how does the trance state compare to self-hypnosis,
And heightened suggestibility.
heightened suggestibility? Okay.
Thank you.
Thank you for this question. Actually, it's a really redundant question that we and a question that there is no consensus in the scientific community to clearly categorize, for example, difference between, let's say, meditation, relaxation, self-hypnosis, auto-induced trance, etc. So we are like trying to answer this question, and I will try to answer this saying, like, we are working with therapists that are hypnotherapists and trained to self-induced trance. And usually they are sharing with us their subjective experience, saying the trance state seems to be more deep and also more embodied or embodied. You see what I mean? I don't know how you can enter in a auto hypnosis state, but in trance, I don't see the suggestion way. When you are in trance, you are in a slight state, dissociative state. I don't know if this is common with hypnosis. Si? Okay.
Mais une auto-hypnose, disons qu'il y a des degrés de profondeur. On dit... j'ai oublié. Bon, c'est pas grave. Et ces degrés de profondeur peuvent faire voilà, la différence. Il faut bien penser que les états de conscience changent, notre état de conscience, il change en permanence. Donc c'est un continuum entre tous ces états. Et donc un état d'auto-hypnose, s'il va être de plus en plus profond, il peut petit à petit nous emmener dans un état plus profond de transe, on va dire, celui qu'on identifie comme étant une transe. Mais c'est vraiment un continuum, d'accord? Parce que parfois, la fin d'une transe, ça ressemble beaucoup à une méditation. Donc notre cerveau va en permanence ajuster notre état de conscience pour faire face à la situation à laquelle on est confronté. Et donc c'est un continuum. C'est pour ça qu'on peut pas séparer, la transe, l'auto-hypnose, la méditation. C'est difficile de faire une séparation parce que c'est toujours un peu de tout. Voilà. Et donc c'est un équilibre des zones cérébrales qui sont en jeu. C'est un équilibre permanent entre tous ces états de conscience.
So there's there's different degrees of depth in different forms, and in some way there's some ends of trances will look like a meditation, and perhaps self-hypnosis can sort of make us sink down to a state of trance. So it's a continuum in the same way that our waking state of consciousness is also in perpetual readjustment to the surroundings, and so there's no clear threshold, which makes this distinguishing difficult. We're working with the sort of self-regulating ability of the brain to answer to any kind of circumstance and trying to map out how it gets from one place to another, but the nodes are not set.
Actually, there is in the literature some specific standard questionnaire for trying to categorize the subjective experience of people in the different states of consciousness, and they are based on different dimensions. The one that we were mentioning just before, for example, the level of emotionality, of time distortion, of cognitive alteration, etc. So it's more like, as we were just saying, it's a continuum, like there is different degree on this different dimension. This is for the subjective experience. And after at an objective level, for example, maybe there is a different pattern of activation between when we would be able to compare people that are in self-hypnosis, people that are in a self-induced trance state, or maybe people in self-hypnosis are feeling more pain or less pain, or you see, we are building the objective criteria to distinguishing these states, like now.
On a fait une étude au CHU de Liège, donc avec Steven Loreis, que vous voyez là, il joue son propre rôle, c'est un neurologue, lui, et il a créé un des plus grands laboratoires au monde qui étudie spécifiquement les états modifiés de conscience. Donc il a énormément de données pour la méditation, l'hypnose, les expériences de mort imminente. Et donc, on a fait un protocole avec 27 transeurs en auto-induction de transe, avec un EEG sur la tête pour voir et comparer, donc peut-être que là on aura des résultats, comparer la différence, est-ce qu'il y a une signature cérébrale spécifique à l'état de méditation, l'état de transe, l'état d'hypnose, voilà, de façon à pouvoir... Alors on pense qu'il y aura des similitudes, des différences, peut-être une signature cérébrale qui est liée à la transe auto-induite, mais peut-être pas, on ne sait pas encore. Donc à partir de là, ce sera publié, bien sûr, dans des revues scientifiques, et à partir de là, on commencera à pouvoir répondre un peu à votre question.
So we're working with Dr. Leris,
Loreis, Steven
in
Loreis.
Liège, who plays his own role in the film, who established the largest laboratory for modified states of consciousness, and so he has a lot of data on different forms of practices, so for meditation, hypnosis, etc. And so we're participating. There's 27 self-induced trance subjects who have gone or are going to undergo this process with the, what's the name of the helmet? I keep on saying helmet. EEG. And so what we're looking for is to see whether or not there is a cerebral signature of a specific kind of state. So we are expecting that there will be some similarities, some differences, and then perhaps something like a cognitive cerebral signature to that state that would be identifiable to try and answer your question. And when we have those results, we'll publish them in a scientific paper, and it will be out there.
Okay, I want to give a chance to wait. There's someone in front of you who is waiting to ask a question, and then your turn. So please.
Hi, sorry, I'm very tired right now, so it might have gone out of my head. Merci beaucoup. That's about all I can get in my French right now. But thank you so much for this incredible experience tonight.
No pressure.
No. I mean, I challenged myself not to take notes, and I didn't, and I should have, perhaps. You spoke up here about non-ordinary states of consciousness, which even includes meditation, nothing as intense as the trance thing and being a wolf and all that stuff. And yet in the movie, which I'm not sure I don't know if it was exact or if it was a little bit dramatized, but there was very much a fear on the part of the sister, and I don't know if you have a real sister, but there was very much of a part, they talked about having a psychotic break, and it sounded like you had been hospitalized and been offered medications, and you said, excuse my language, fuck that, and dropped them in the garbage. She doesn't understand my mind at all. And here we are in New York and in the West, and everyone's popping everything left, right, and center, and all the therapists trying to reduce people's pain are throwing antidepressants and atypical antipsychotics and all that stuff down people's throats, left, right, and center, and putting people in hospitals and saying, you've had a psychotic break. And I just wonder, I mean, you're not an expert on life, or I don't know. I'm wondering, especially for these two ladies at the end over here, it was fascinating to see the helmet thing.
So is your question maybe about, how this, whether an understanding of what the trance state is can help us understand what might be interpreted in our context as a psychotic break?
Exactly. Like for instance, have you guys now in the 10 years or so that you've been doing this research, have you been working along with people, experts in the psychiatric field, and made any headway or come to any conclusions with them as to, those might not be such psychotic breaks. They might actually be altered states of consciousness.
On
On a feed.
On a formé des psychiatres, on a formé des neurologues à la transe auto-induite et en vivant des transes, ils ont constaté que parmi leurs patients, il y avait des gens qu'ils avaient identifiés comme étant pathologiques et donc ils se sont dit peut-être que ce que eux vivent, ça ressemble à ce que moi je vis pendant la transe. D'accord ? Je peux traduire. Oui, je peux continuer. Et donc, la question s'est posée, est-ce que ce que vivent ces patients, ce ne serait pas des transes spontanées parce qu'ils ont eu un choc psychologique en général qui a déclenché chez eux des mouvements incontrôlés et qui ressemblent beaucoup à des états de transe. Donc la question a été posée, est-ce que c'est une transe spontanée? Voilà, donc on a formé 2 patientes qui avaient ce qu'on appelle des crises dissociatives, ce dont parlait Audrey tout à l'heure, qui s'appelle aussi crise non épileptique psychogène, on peut dire crise dissociative, qu'on a formées à la transe et qui n'en ont plus du tout aujourd'hui. Voilà. Donc c'est très handicapant les crises dissociatives, parce qu'on a l'impression que ça ressemble à une crise d'épilepsie, mais ça n'en est pas. Et ça peut arriver n'importe où, dans la rue, dans le supermarché, chez soi, en dehors de chez soi. Et c'est très, très handicapant pour ces gens-là. Donc, c'est des femmes qui avaient ça depuis, pour l'une, 15 ans et pour l'autre, 40 ans. Et en quelques mois, ça a été réglé, elles n'en ont plus aujourd'hui. En revanche, elles savent vivre des transes auto-induites et elles travaillent à partir de ça.
So the way that we're going about sort of entering into the world of psychiatry first is by training neuroscientists and training psychiatrists to the self-induced trance, which then has allowed them to identify within their experience things that had been located in their patients as being pathological, on which they've then come back over and realized that perhaps some of the people that they had wrongly diagnosed as being a kind of psychopathological experience was, in other terms, a spontaneous trance that led them to come to uncontrolled states, both cognitive and embodied. So that's one sort of direction to influence that medicine. And on the other, as Audrey was talking about, we also had 2 patients who suffered from dissociative crises, or the non-epileptic psychoseizures, which look like epileptic seizures but are not. One woman had been living with this for 15 years, another for 40 years, and it's a very difficult thing to live with. It happens anytime in the supermarket, wherever. And as we said earlier, we have a full recovery for both of them from having learned this technique, and so they no longer have these spontaneous crises, but they know how to go into self-induced trances and have a relationship to that of another kind.
Let's take time for one last question.
Thank you. This is fascinating. My question is, it seemed that the role of the shaman is to serve the community and to be a link between the community and another world, the spirit world. So I guess my question in terms of your research and where you're thinking, because it sounds like it's fascinating, but it's very self-oriented, as in people are learning how to self-trance. Are they then working to take that knowledge and that skill set and bring it in, again, to link up either to a spiritual aspect or to work with others versus, because the shaman is so much about that link versus just their own trance. So I'm just curious how this trance or this skill that people are using seems to be great in terms of reducing pain, reducing anxiety for their own
Yes.
personal health. But the shaman is not just about themselves, they're about a bigger world.
Oui, mais c'est parce qu'il vit cet état de transe qu'il est au service de la communauté. Et donc nous-mêmes, en étant tous en transe, on est en connexion avec un monde plus grand que nous. On est mieux en connexion entre nous. Et c'est pour ça que Audrey travaille sur la cognition sociale. Elle va vous l'expliquer. Et en quoi la pratique de la transe au niveau individuel peut nous permettre de mieux nous comprendre entre nous et d'élargir notre relation au vivant, notre relation à notre environnement, en avoir une connexion beaucoup plus forte et une nouvelle voie d'exploration et de collaboration avec le monde.
So yes, but it is because of this original experience of the trance that the shaman then can come into an ability for collectivity and serve, as you were saying. So that's sort of the first step to then allow for a different and augmented relationship to other people, but also to the life world, to a wider world in many ways, which is why Audrey works on social cognition, as she's about to explain.
Yeah, actually, your remarks, your question is really relevant because it can give the idea that maybe practicing this is only focusing on the self, but actually the hypothesis that we have is that it's going to create some deep changements in people that are going to help them to better navigating their world, or even maybe live in their world, or maybe consider the other living being.
Consider other beings?
Yeah, other beings, actually, in general. Sorry, I'm a bit tired. For example, in the research I've been making, like I'm comparing the effect of I'm considering different mechanism in expert trancer, like people that are going to that are able to auto-induce trance since more than 1 year, compared to people that are going to be trained. And I'm looking if, for example, they have better interpersonal relationship, or if they are more altruistic person, or if they are more empathic. It's a small focus on some of the changes that maybe are happening when practicing this non-ordinary states of consciousness, but the idea behind this is that, and it's not my idea, I mean, many researchers in the other domain are supporting this hypothesis that practicing this kind of states of consciousness would create deep and modification that will enable people to have better health habits, or to maintaining changes, to be like to feel better and to be more with the other. Okay, so in this kind of state, for example, people are experiencing permeability between their self and the other. Sometimes, of course, the state is really internally focused, but sometimes you have the feeling that you are somebody else, or even something else. It gives you another perspective, and sometimes so strong that you have the feeling that you are losing yourself. It's called ego dissolution, you see. And experiencing this, it's usually associated with a big changes in the life of everybody. You see, I don't know if it's responding to your question, answering.
I see one more person with a question.
Hi, I'm Mongolian student at Columbia, and the first I would like to say, like, thank you so much for making the film, and also doing the research. And personally, I have seen the whole process of like half shaman to all the thing, and I think that in terms of film, all the scenes were like very authentic, and I never seen like any scene that maybe inaccurately like reflected the real the experience I had there. So also I was really amazed by how the people, as you talked, the 2 patients fully recovered, and also it has been, I never thought that kind of like a spiritual link can be like explained by like science and can be benefit the people who are suffering from like anxiety or trauma. So I have no questions, just want to say thank you and wishing you all the best. Yeah.
Thank you.
Okay, well, do you want to say anything in response? I think that's a wonderful note to end on. Thank you so much for coming here to be with us and for sharing your research. And we invite you to come back and do a training in New York if you'd like to do that. If anyone wants to sign up outside the door, we'll invite Corine back. So thank you so much.